Hello and welcome. Every single day, medical professionals are out there making calls that can literally change a person's life forever. It's this incredible space where pure science crashes right into our deepest human values. And figuring out how to navigate that intersection, well, that's one of the biggest challenges in all of medicine.
So let's just dive right in with a question that gets to the absolute heart of the matter. Picture this. A patient is refusing a treatment that you know will save their life. Medically, the answer seems crystal clear, right? But the human side of it is, well, it's a lot messier. What's a doctor supposed to do when their duty to save a life goes head-to-head with their duty to respect a patient's choice?
To even begin to answer that, a doctor needs way more than a medical textbook. They need a kind of compass. They've got to chart a course through 3 different but totally interconnected worlds: the shared principles of professional ethics, the personal map of their own morality, and of course, the hard and fast rules of the law. Getting this balance right is everything.
Okay, so let's start with what this looks like in the real world. Section 1, the doctor's dilemma.
Look, this isn't some rare, dramatic thing you see in a movie. It's a constant tightrope walk. With pretty much every patient, a doctor is juggling their own personal beliefs, what the profession expects of them, and what the law demands. It's a delicate balancing act that happens over and over, every single day.
So how do they manage all that? Well, the first tool they reach for is what we're going to call the compass of ethics. And this isn't about a gut feeling. Think of it as the universal true north for the entire medical field, pointing every doctor in the same basic direction.
So medical ethics is basically a shared framework. It's not about what one person thinks is right. It's a system built on universal principles that's designed to guide a doctor's actions. Its whole job is to give a clear, consistent way to figure out the right thing to do, no matter where in the world you're practicing.
And this ethical compass has 4 main points. First, you've got beneficence. That just means always trying to do what's best for the patient. Next is non-maleficence, the famous first, do no harm. Then there's justice, making sure care is fair for everyone. And finally, autonomy, respecting that the patient gets to make their own decisions. Now, here's where it gets really tricky. These principles can actually conflict with each other. For instance, doing what's best for the patient might clash directly with their right to say no.
All right, so if ethics is the universal compass pointing everyone north, our next guide is totally different. It's more like a personal map, one that's drawn from our own unique life experiences. This is the map of morality.
Now, unlike ethics, morality is super personal. It's our own private set of beliefs, shaped by our family, our culture, our religion, you name it. And here's the kicker. It's not just the doctor who has a moral map. The patient has one too, and so does their family. And a lot of the time, those maps are trying to lead everyone to completely different places.
And sometimes that conflict is just unavoidable. This one sentence says it all, doesn't it? When a patient's deeply held moral beliefs run straight into a medical recommendation, the doctor is stuck right in the middle of a major crossroads. And this stuff happens all the time. Just think about some real-world examples. Some religious beliefs forbid blood transfusions. Different cultural traditions have completely different ideas about end-of-life care. These diverse moral maps are everywhere, and a good doctor has to be ready to navigate them all with a ton of respect.
And that brings us to our third and final guide. Now, this one isn't a compass and it's not a map. This is a set of non-negotiables, black and white rules. These are the rules of law.
See, unlike ethics or morality, the law isn't a suggestion. It's not something you just think about. It is a set of mandatory rules created by the government. These laws are there to regulate medicine, protect the public, and spell out exactly what the rights and duties are for everyone involved. They are not optional.
This table really breaks it down perfectly. Just look at the differences. Ethics comes from universal principles, and it's all about reflection. Morality is totally personal and changes from person to person. But the law, it's from the state, it's mandatory, and it applies to everyone. That distinction is absolutely critical for keeping the whole system working.
And in pretty much any country, this legal rulebook is built on a few key things. It usually starts with a constitution that guarantees a right to health. Then you've got specific health laws, all sorts of regulations, and this idea of a standard of care that basically defines what good medical practice looks like. These are the rules of the road every doctor has to follow.
So we have ethics, morality, and law. But why is it so incredibly important to know the difference? Because in medicine, what you don't know can absolutely hurt you and your patient. Which brings us to a huge idea. Knowledge is protection.
Let me just paint you 2 different pictures. On one side, you have the doctor who's a little fuzzy on the legal stuff, they're exposed, they're facing legal risks, they're chipping away at patient trust without even realizing it, and they're constantly wrestling with these ethical conflicts. But on the other side, you've got the informed doctor. They practice with confidence, they build way stronger relationships with their patients, and they make decisions that are clear and, really importantly, defensible.
And believe me, the consequences of getting this wrong are no joke. We're talking about massive malpractice lawsuits, big fines, getting your license suspended, and in the worst cases, even facing criminal charges. And beyond all of that, there's the one thing you can never really recover from: a ruined reputation. The stakes really could not be any higher.
But look, the point here isn't to scare anybody. It's actually about empowerment. Because understanding the law isn't some kind of threat. It is the absolute foundation of safe and confident medical practice.
Seriously, knowing the law is like having a superpower. It protects the doctor, acting like a shield if they're ever sued. It guarantees the rights of the patient, which is how you build trust. It even makes teamwork better, because everyone knows their role. It empowers the doctor to make those really tough calls with confidence. And all of that adds up to better, safer care for everybody.
So maybe we need to change how we think about the law. It's not some restrictive cage that holds doctors back. It's the solid foundation. It's the sturdy ground that allows doctors to build their practice, to navigate all those tricky ethical situations, and to make the safest, most responsible choices for the people they're trying to help.
And that kind of leaves us with one final big question to think about. Medicine is changing at lightning speed. We've got artificial intelligence, gene editing, technologies we can't even dream of yet. So the question is, can our frameworks for ethics, morality, and especially the law actually keep up? Are the rules we have today really ready for the medicine of tomorrow?